Lesbian and bisexual women are invisible in the healthcare system.
Health services really are absolutely key to any community.
There is very little understanding of their healthcare needs, and in some cases, poor advice is given by healthcare professionals on what steps lesbian and bisexual women need to take to ensure they are in good health.
A third of gay men have had a negative experiences of healthcare services in the past year.
The way in which the service is different is sometimes quite subtle. It's about an approach, a way of working with people that makes them feel comfortable.
If professionals don't know what's needed for a particular individual, they need to just be able to respectfully ask questions.
Understanding the way in which, say, their family structure works and who they may want with them, say, in an end-of-life situation.
Having said, look, I'm gay, what you don't want is for people to say, oh, that's okay, and then move on.
LGBT-specific services have a unique role in providing services that the mainstream just can't cater for.
LGBT health services are unique. I mean, that's the point of them, I suppose, in a way. They offer services that are really customised to that audience.
And some of that is about the power of coming together and the sheer weight of numbers. Some of it is about empathy. Some of it is about the shared knowledge and the shared community.
They're enabling people to access health services that otherwise wouldn't.
A better understanding and awareness around sexual orientation and around gender identity that most NHS services simply don't have at the moment.
Ultimately, there isn't a big difference in need. Everybody needs a health service that is responsive, that appreciates them as a human being.
At this point in time, it's important that we have them because they're filling an important gap, but the ideal is that lesbian, gay, bisexual and transgender people can access the NHS without fear of discrimination and with appropriate healthcare.
What we want to actually see at Stonewall is integrated services in mainstream where all services are accessible to lesbian, gay, bisexual people.
These things should be mainstreamed, whereas the Equality Act now, you should be treated with dignity and respect regardless of your sexual orientation or gender identity.
We're all human, first and foremost, and in the end, all dust.
A fundamental need is health and social care. So if those services can work better for LGBT people, that has an enormous impact.
Commissioners need to be quite integrated about the whole line from the grassroots community, LGBT health and wellbeing needs, right through service provision to management, to policymakers, to them.
Commissioning is the new big thing, and something else we simply cannot ignore.
So I would say to commissioners, you need to look at the evidence. There's a wealth of evidence out there. Listen to specialists like me and like the people at this conference.
Gay and bisexual issues are still a fairly niche topic in the medical school curricula. We need to change this.
Make it an action to go away, find out who is leading on the development of your local health watch. Influence, and even badger people if you have to, because now is the time.
Take our advice in commissioning services which are not just about short-term responses to HIV testing rates or the number of people being diagnosed late. Those are very important, but there's a big range of other stuff that is really important as well.
We are worth fighting for, and lives can be improved. So please keep up the amazing work that you're all doing, and let's make sure that the new system works for us. Thank you.